Greetings everyone, this is Abhi. In this video, I've summarized all the important screening schedules for the relevant topics I've come across in UWorld. The information here is based on the USPTF guidelines. I hope you find this useful, and if you like my presentation, there is a link to download these slides in a PDF format in the description of this video. Now let's get to it. There are four cancers that we screen for: lung, colon, breast, and cervix. The colorectal cancer is the fourth most common cancer in the United States. The screening for colorectal cancer starts at the age of 50 and ends at 75. All the general population is screened for colorectal cancer. There are three modalities available: colonoscopy, which is done every 10 years, fecal occult blood testing or fecal immunohistochemical testing, which is done annually, and flexible sigmoidoscopy, which is done every 5 years. Additional point here is that flexible sigmoidoscopy can be done every 10 years when combined with FOBT or FIT done annually. Another important factor here is that patients which have first degree relatives with a history of CRC, in these individuals we start screening at the age of 40 or 10 years before the age of diagnosis in their relative with CRC. Whichever of these age comes first is the point where we start screening. Lung cancer is the third most common cancer in the United States in terms of incidence in both males and females. Yet, not every individual is screened for lung cancer. The individual with a greater than 30 pack year smoking history and someone who is a current smoker or someone who has quit within the last 15 years are the people who are at risk. Screening modality is a low dose chest CT scan, and the age at which we start screening is the 55 years, and screening is done annually. We stop screening for lung cancer after the age of 80, or if the individual has quit smoking for more than or equal to 15 years. Also, if an individual has another medical condition which limits the life expectancy or the ability or desire to undergo lung cancer surgery. Now, about breast cancer, this is the second most common cancer in females after skin cancer, and all the general population is screened with mammography beginning at the age of 50 years. The screening interval is 2 years, and we stop screening after the age of 74. Important points about breast cancer are that self examination is not recommended, and screening mammogram is not recommended in women with the age of less than 30 years. And another important point here is that genetic counseling and testing in women with higher risk family history is recommended. Cervical cancer. All women are screened for cervical cancer starting at the age of 21 years, and the modality that we use is cytology by pap smear, which is done every 3 years, and screening is done up to the age of 65 years. Another method of testing is cytology plus HPV testing, but the minimum age is 30 years, and co-testing with cytology plus HPV can be done every 5 years. There is no need for screening in individuals less than 21 years of age, regardless of onset of sexual activity, and HPV testing should not be done for individuals less than 30 years of age because the infection is often transient and it resolves on its own. There is a special criteria for immunocompromised patients, such as patients with HIV, SLE, or organ transplant patients that are taking immunosuppressants. In these patients, we start screening for cervical cancer at the onset of sexual activity, and we use cytology by pap smear. Screening is done every 6 months for the first year, and then it is done annually. We can stop screening for cervical cancer if a patient has had hysterectomy with the cervix removed without any high history of high-grade precancerous lesion or cervical cancer or any exposure to diethylstilbestrol, or if the patient is greater than 65 years of age who has had 3 consecutive negative pap smears or 2 consecutive negative co-testing results. So those are the cancers that we screen for. Some other questions that come up are regarding prostate cancer or ovarian cancer, and they can often confuse you, but just keep in mind that in general population, we don't screen for these cancers, no matter what the question says. Abdominal aortic aneurysm. Any male who has smoked in his lifetime, that is, a lifetime exposure of greater than 100 cigarettes, is at risk of abdominal aortic aneurysm. Because the mortality is so high, the guidelines recommend a one time screening with abdominal duplex ultrasound between the age of 65 and 75 years. Since the ultrasound is highly sensitive, is cost effective and non invasive, it is an excellent method for screening out abdominal aortic aneurysm. Osteoporosis. All women starting the age of 65 are screened for osteoporosis with a central DEXA scan of hip and spine. A one time screening is recommended, and based on the T score, further screening intervals are determined. A T score of less than -1.0 or above is considered normal bone density. T score between -1 and 2.4 is considered osteopenia, and a T score that is below -2.5 is consistent with osteoporosis. Keep in mind the osteoporosis patients are treated with vitamin D and bisphosphonates. Diabetes mellitus. All the patients that are overweight or obese, that is over the BMI of 25 kg per meter square, are recommended to undergo screening for diabetes mellitus with a HbA1c, a fasting blood glucose, a random blood glucose, or a 2-hour oral glucose tolerance test. The starting stage of this screening is 40 years and the end of screening is at 70 years, and the testing is repeated every 3 years if the tests are normal. Now we'll talk about hyperlipidemia. All the general population is screened for hyperlipidemia starting at the age of 35 years for men and 45 years for women. Testing is done with a lipid panel, and the recommended interval is every 5 years. Regarding hypertension, there is a rule that every individual gets screens in every office visit. The following individuals are screened for hepatitis C virus: patients with a chronically elevated ALT, HIV positive patients, patients with HCV risk factors such as IV drug use, individuals who have received clotting factors before the year 1987, any individual who has received blood transfusions before 1992, patients who are on chronic hemodialysis, or individuals that are born in the US between the years 1945 and 1965, aka the baby boomers, and sexual contacts of patients who are HCV positive should also be screened. Now, regarding HIV screening, the question is which individuals are screened. So, all the individuals between age 15 and 65 are screened. Also, individuals which are younger or older can be screened if they are at risk. Pregnant women, regardless of normal results in their previous pregnancy or before that, they should also be screened. Any individuals that are taking treatment for tuberculosis or any other STD should be screened for HIV. There is a certain group of individuals which require annual screening or, in some cases, even more frequent screening. These are as follows: IV drug users and their sexual partners, men who have sex with men, individuals having sex for drugs or money, partners of HIV infected patients, patients or partners that have had greater than one partner since the last HIV test, or individuals living in a homeless shelter or a correctional facility. Lastly, we'll talk about individuals which require an additional screening after the initial screening. These are individuals which are exposed to blood or bodily fluid of HIV patients at work. Uh, any patients with a new STD symptoms should be screened for HIV, and it is suggested but not necessary that patient may get screened prior to starting new relationship. Thank you for watching my video. And please mention in the comments if there are any ways in which I can improve my content or my voiceover. And best of luck to you, and I hope you find this useful.